Hey everybody, Judy Seeger here, and we have a documentary, kind of, sort of, where what we're going to do is walk you through the exact procedure of how to heal something that's off in your body. So I have an imbalance in my shoulders. It happened about 6 months ago, and I have tried chiropractic work, I have tried physical therapy, I've tried exercises, the things that I know, and it gave me some measure of relief. Then I went to doing saunas and PMFs and all these electromagnetic things. That helped somewhat also. Then I had a Ozone shot with procaine. That took the initial pain out of the shoulder, but I'm still having pain in my muscles. I mean, I actually touch it and I can feel it's hot, like it's like inflamed. So I'm here in Miami, Florida. Dr. Dennis Harper is here with his wife, Shirley, and they are down here for a conference, and we're going to walk you through what it actually looks like when somebody like me is in pain and how we're going to heal it.
Good morning, Judy. So we're going to check you out, just a brief screen on you. We're going to listen to what your body tells us on this.
Okay.
And what I found with difficult patients like you that have been through courses of therapy, sometimes there's something that's blocking you from getting better.
Yeah.
So we're going to check and see if we find that blockage in your system, and we'll have a little fun with this.
Is it a physical blockage or?
We're going to show you that.
Okay.
And what we're going to do with this is we're going to actually check and see if there's an emotional break. So we're going to do a brief check on you. There's a couple things I already see with you, and we're going to check that. I'm sure we come over. I'm just going to test you. I use her as a surrogate.
Okay.
And again, this is not something we use on all the patients, but when people have something that's been around the block checking, we step back and say, wait a minute, there's something really off on this.
Yeah.
So when we talk to you today,
Yeah, it's going to be
very quick, and you're going to see stuff you're not going to really understand.
All right, I'm ready. Here it is.
So that's the way we're going to approach
I know.
this and do this. So
All right,
we're going to go
let's
through
do
this really
it.
quickly.
All right.
So we'll do upper body and do that.
Okay.
And so we're going to do that to start with. All right?
Okay, yeah.
So first thing when I have a patient come in, you're going to be sitting in the chair, please.
Okay.
So when I come into my office, it's very simple. I walk in, my desk is where the camera is here.
Yep.
I'm going to walk in, I generally put my hand on your shoulder.
Okay.
Now, I
can immediately, so you know, I can immediately feel there's a somebody who is in authority that could help me. Like there's a feeling of like a connection right away. Whereas, some people are just like, they hardly even touch you, whatever, but I can immediately feel that. So that immediately makes me feel better.
You never waste, you let your hands do the walking.
Right. And
I
that's
love
how
that
I
whole
yeah.
thing. And so
true.
I do that, I squeeze this. What have I found? I've seen if she's swollen as far as tissue swelling, muscle tension. I feel the basic energy if she's stressed. And I can feel immediately that she's not swollen, there's no tissue swelling, but there's an emotional stress. I can feel it right immediately there. So immediately pick that up right off the bat. So I know we've got an issue. Next thing I turn around and said, Judy, it's absolutely wonderful feeling today. So what have I done with that? I've actually broken down that barrier.
Yeah.
Because I've taken you off guard. So you're no longer in control.
Right.
You may think you are and try to tell me you are, but your body has given over to me right now. And I don't kill him. It's just a very firm handshake.
Yeah, like he means business. Like I know.
We're here to take care of your body.
Yeah.
Not your ego.
Right.
Not your self-destruction methods. Not those
my
things.
ego.
So we're changing those things immediately off the bat. So I do that. Then I'll turn on my desk and I'll kick back and say, great to see you, Judy. Why are you here today?
Because I have pain in my upper arms. It wasn't my shoulder. No, I can't lift my shoulder. I can't lift my arm to the point where, without it being painful.
So
Like just like one day I was fine, the next day was like, and I never had shoulder pain in my whole life, ever.
So that's way exciting. So we know there's something really fun going on there to change us. So these are the fun ones we get that I like seeing in the office. Like, okay, what's really causing that? And we know from a lot of background that I found years ago that typically frozen shoulder syndromes, things like that, happen in women a lot, and it's usually a metabolism problem, a sugar problem, or an emotional problem.
No, I had a major fall, and I've had a lot of car accidents, a lot of whiplash.
Okay, so now we know the story.
Yeah, but I had a major fall that really affected my neck. I fell down a flight of stairs, and I had a major car accident that hit me, and that has had problems. It's always felt weak. I've always felt like a little bit, if I don't exercise, I always feel weak.
So what we find with that is an emotional trigger with the trauma from the accident, and that
Yeah,
could
right,
be the start of the whole thing.
Yeah, the trauma probably hasn't healed completely, and my body still probably remembers it.
Correct.
Because when I go down the stairs, in fact, see now,
Yeah, see, it
when I
comes
walk
up.
down the stairs, I still get a little bit, and that
Emotional
accident
trauma.
was 22 years ago.
Correct. So what we found with some of
Trauma's in my muscles.
Dr. Hammer's work, and this is where
Dr. Rieker Hamer,
Rieker
right?
Hamer.
New age medicine. That's a
New age medicine.
huge,
Yes.
huge study. Yeah.
So we've actually incorporated that into some of our treatments.
Yeah, yeah.
And we have a 3-minute reset for that, which can make amazing differences with that. And we're going to do that on a simple level today.
Okay.
So I've done the handshake, I've done the basic stuff here, and so we read a couple things here. So now physical exam, I'll have the patient go up, walk to the office. I'll watch them walk for about 4 steps. And I get an idea if they're gated wrong, if there's an issue with that we have to deal with. You've got a little bit of left hip issue that kind of bothers there, I can see when you walk.
Yep.
So I noticed that's there right off the bat.
I didn't even tell him that. He figured out the left hip was off a little bit.
And if you see the way she sits up with the left hip a little funny there. Her left shoulder's forward, and she's guarded in the neck. And that's really
and it's
easy to
hurting even
pick
just
up.
as I'm talking to you,
Yes.
because I have to put my head up. It
Right.
hurts.
So that's an issue. So we're going to take and just show those and make those show up as an issue, and then we'll change those. So that's a very simple thing we'll be able to do just sitting there. We'll be able to do it real simply. So that'll be kind of fun. So I'm going to sneak it behind you here and walk right on behind you. And when I do a basic exam on upper thing, I'm going to take and come down here. I'm going to gently come down here. We'll check TMJ joints. We
It's not
come around, check
missing, it's
thyroid.
pushing in there.
Hmm?
I said you're pushing in there, like you're really looking in there.
We're seriously looking. We're not just patting her.
Have
There's
you ever
no
been to
fluff.
those chiropractors
There's
where
no
they're like
fluff.
so soft? Yeah,
There's no fluff going on.
Yeah, there's no fluff
We're
going on.
feeling, and we got our
Ouch.
left
It's
TMJ
like,
joint,
ow.
not compared to the right. You can see her TMJ, and this is stress from the neck. Okay, I come around and feel thyroids. We always look for nodules on the thyroid. Thyroid now, Hashimoto's is out of control now.
Yeah, it's risen, it's
Yeah,
true.
and that's from a whole different reasons we'll talk about later. I go to the neck. I'm going to come down both sides of the neck, and we've got a real sore neck on the right
Yeah,
side,
like really sore.
and a sore one on the left side here.
Yeah.
So we see 2 issues there. I come down to the front of the clavicle. I'm going to come around here, and we're really sore here compared to this side. And front, we're going to set this here, and we got a soreness
Actually,
here.
this sore is more. This side is more sore.
This is more sore than this
Yeah,
one.
now. Yeah.
Right, right. This one's guarded. This one's numb,
Okay.
and you can feel that it's just numb. It's blank.
Yeah.
There's no energy right here.
No, I
And
can
this
feel-
is
yeah.
hyper upright. That's why it's tender more in the biceps tendon here. Here, we're going to check strength here, real G. So we hold your arm straight, ask you to resist, hold it up.
Okay, so what are you doing there, Doc? I mean, I
Okay,
know
what I'm doing is I'm going to check C5 dermatome. So I ask you to resist, hold it up. And she has no strength here in this arm.
None. I can't. Like I'm really trying hard to hold it up.
Hold this
and I
one
can't.
straight up here. Hold it up straight, hold tight. Now see, it's actually stronger than the right one.
It is stronger, but it hurts more.
Yes, that's
Yeah.
because of shoulder pain.
Right.
But the dermatome from the neck isn't affected. It's
Right.
affecting the right side. So your right shoulder pain is probably coming from your neck.
Yep.
And it's making the right shoulder not get better.
Right.
So it's different there. So that's where it comes down to finding the source of the issue.
Right, right.
Now I'm going to check some general strength of your body. Hold your arm up straight, ask you to resist, hold it up for me, hold it.
No.
Hold the arm up, hold this one up, hold it. No strength at all there.
No, not either one.
Your adrenals are totally shot.
My adrenals are shot. That means I need a trip to Hawaii for a couple of weeks and
Trip
just
to Hawaii,
drink
and we're going to
some
turn your
pina colada.
adrenals on today. Alright, so we're
I
going to
like
turn
that.
you on today, so we're going to make you
I could get turned
function
on.
better, alright?
Okay.
Okay, so now is the fun part
Okay.
we're going to do, okay? And it's a little warm in here, but we're still going to check that. Shirley, I need you real quick over here, please. I'll use a surrogate for muscle testing or not, but I'm
Okay.
just going to check 3 points on you really quickly. Ask you to resist, hold it up for me. Hold it here,
Can we do that in front of the camera? Can we do so that you guys can watch? Yeah.
hold. Now, we found that center head here and 2 points here are extremely strong. We should have a PMF rebalancing for this. It takes 1 minute in each spot to rebalance the system.
Which we'll talk about in
We'll
other
talk about
videos
in other
PMS,
videos.
yeah.
Now hold. Hold. Now see, her toxic points are good, her adrenal points are shot, hormones are strong, and adrenals are totally weak. So now we're going to take and change those in a real simple method. I can do this actually by holding those points for about 15 seconds, and we're going to kind of play with this experience a little bit, and we're going to be able to be a little fun, alright?
We're going to have fun.
Alright, so that's what we're going to do with this, alright? Now, I'm going to run my hand gently over that same spot in your head.
Oh yeah, I could already do that.
You can feel it right there.
Right there, yep.
And what I feel is I feel a real funny sensation right
So
here.
what is that?
Well, we did a year of EEGs in the office. We actually checked brain patterning, and we found disrupted brain patterning at those points.
That's a big thing this year. Brain patterns, brain health, brain everything is huge. But to fix that, typically we go to diet, and that's just not enough.
Not enough, diet's not enough, and also you would find, we did pre and post testing after our procedures. We were getting the same results, or in fact we got better results than they got with 40 treatments of biofeedback.
Wow.
With one treatment.
Wow.
In 3 minutes.
In 3, I like that.
Okay.
All right, so this here is checking the pattern.
Correct.
Okay,
So
gotcha.
what we've learned is we're in a simple system to reset this and the adrenals in coordination and open that pathway.
Okay.
So what we'll do is, you've been in a neural limp for a long time, and I call it a neurological limp.
A limp. Okay.
So in other words, you had an injury,
Yep.
it stays there. Doesn't go away because the body's stuck in that loop. So it doesn't recognize the ability to heal that.
Right.
So what we're going to do is open that pathway so it has the ability to heal it. Now, let's rate pain-wise, shoulders, things like this, probably a 7 on this one, and this hip was, what did you say, what level that was at?
Oh, that was an 8, 9.
Yep.
That was
8,
painful.
9.
Yeah,
Yes.
that was high.
And the neck pain up here, probably a 7.
Yeah, it's like a chronic.
Chronic.
Yeah, it's
Okay.
chronic. That's been chronic. This is new, so again, it's about a 7.
Okay, good. So what we're going to do is we're going to take and reset her adrenals, and we do a very simple thing. And being a healer, you'll feel a sensation when that releases.
Okay.
So I'm going to hold 2 places on you for 15 seconds each.
Okay.
And what you're going to notice and see if everything just lets go and happens with this, all right?
All right.
So real gently, I'm just going to sit by you. Now I'm going to touch your leg right here. So we're going to make a circuit. So if you can imagine your body's an electrical circuit, I'm going to open those pathways up. So I'm going to take and hold 2 places on your head here, and hold 1 here and 1 here. Now you will feel these, and you'll just take and just breathe. Just gently move forward and breathe. And I'm going to touch here.
I can feel that in my neck.
Yes. Yeah. I've had people have all sorts of experiences after this.
Yeah,
from
just
their
something
body
like
detoxing, flushing, strange dreams the night afterwards, things like that. So I'm doing this here because we don't have the equipment to use it.
Right.
What we use is pulse magnetic. We'll hit those points. We have a patterning all set up to do that. It takes a minute. And a lot of times I don't even tell patients what I'm doing. I said, we're going to reset your brain. I send them back and we do that. And they wake up with post-traumatic stress syndromes, anxiety issues. We found that settles down in one treatment with that. And we have a system of doing adrenals, detox, and hormones. It's a 3-step system. They do a week apart. Very simple. Staff does it. I said I want the brain reset. I want the adrenals, whatever, and done that. So we change that, all right? So now we're going to check and see how it affected you. Half
Wow.
gone or more, isn't it?
Yeah, I mean this part, the hip itself is totally gone.
Yep.
Pain, and then but down here it's like went down like to 3.
Yep.
Yeah.
Now see the neck?
Yeah.
It's down to a 1 or
Yeah.
2.
See, that feels nice.
Yep. And this is gone.
Yeah, it's completely gone. That's exactly right.
Yep. And the right shoulder pain is gone.
Gone.
Okay? And the fun one is going to be the shoulder. Let's raise the shoulder up. Raise it.
It's better.
Yeah, it's not.
I mean, it's still stiff in here a little
But
bit.
look how far you're raising it.
Yeah.
You couldn't raise it there before.
No. Yeah, that feels a whole lot better.
Now this is going to be the really interesting one. Hold your arm up straight. Ask her to resist. Hold it up. Hold the left front. Hold it.
Stronger. Both
Stronger.
of them. Yeah.
Hold this
both,
front to the side. Hold it. See how much stronger that is?
Wow.
You couldn't hold that up at all.
No.
Now let's go forward. Here. Hold tight.
Right.
Hold. See the difference there? Hold them here. Push. Push.
All right, watch out, Rocky. I could feel it. So everything's a whole lot stronger.
Yes.
Wow.
But now we can adjust the shoulder because your brain isn't trying to keep that injury.
Right.
So your brain actually will try to keep that injury.
Why do you think that is? Is it a protection mode?
Well, if you go to Hammer's work, you'll understand part of it.
Right.
It's a protective
No, I'm
mechanism.
explaining it to those guys.
Yeah.
Yeah.
And so what you find is the body actually, it can affect cancers, it can affect cardiovascular
Huge
disease.
for cancer, the trauma. Yeah.
The trauma, because the
Right.
trauma never heals.
Right.
So what we did is open the body's own abilities to heal.
And
All-
don't you find too that when this is all opened up and now the pathways are open and the energy is going, the flow is going, that the healing gets accelerated?
Healing accelerates and they get better quicker,
Yeah.
and it stays that way longer.
Right. Right. So that's
And that's the big issue, is ultimately getting to the core problem. I think that's the issue we
Yeah.
find doesn't happen with most healers and
Right.
most practitioners.
So that's
And patients are frustrated right now because they're given so many drugs that deter them from getting better. They don't even know which ends up after a while.
right. So the next part of this, Doc, would be the Prolozone shot, yeah?
I would do and we're talking about Prolozone shot, which is an interesting term that was coined years ago that means an injection with ozone and supplements. We use Harper restoration system, and we do that because we've defined it more particular. I found that if you go out and ask for Prolozone now, you go to a dozen offices and get a dozen different formulas. I know those formulas have changed in my office and everybody else's office over the years. We've got a system now that we're pretty consistent with our doctors that use Harper restoration system. Is pretty consistent with the same mixture protocols that we teach.
Right. So that we're going to share later about where they could find that, because
Correct.
not everybody's going to go to Idaho, but we want to share that. And then just to know the process that by doing these different steps, people are going to get healed faster. It's going to cost them less, and in the long run, really, their disease gets reduced or completely healed.
Correct.
We're going to send them to your website so that they can find practitioners all over the world.
Right.
And we're going to get the rest of this process because I'm here today and tomorrow, and you guys will watch and then comment below to let me know what are you struggling with right now, right? So that's the big issue, is what are they struggling with? We want to help you guys.
And educate your doctors.
Yeah.
Sometimes you got to talk to your doctor. You know, there's some techniques out there maybe you should look at.
Yep.
And I know they're busy a lot of times, but I know that maybe there's easier ways for them to help you.
Right.
And we want to help them.
We'll get you to tell us what you're blocked with. Then we're going to teach you to tell your doc, and then we're going to get you healed, and that's really what it's all about. So we'll catch you on the next episode. Doc, thank you so much.
You're welcome, Judy.
Appreciate
It's been a pleasure. Lots of fun.
I know, right? It's always a lot of fun. All right, guys, we'll see you in the next episode.
Thank you.